Hello, everyone. Thank you so much for joining me today. I'm super excited to be back on live. And my name is Joanna Amarante. I am a trichologist in the Tampa Bay area. And I'm here to talk to you this week about hair loss. We spoke about last week about hair loss, and we kind of broke down different types of hair loss that people may experience through different causes and effect that happens in our body that will cause you to have hair loss. So this week, I want to start off with anagen effluvium. Last week I ended with telogen, so this week I wanted to start with anagen effluvium. So I'm super excited to get started, and you guys know that if you have any comments, questions, concerns, feel free to fill it out in the comment box and or DM me so that I can go ahead and answer your questions. Okay, so we'll get right to it. So anagen effluvium refers to the hair shedding that arises during our anagen or growth stage in our hair cycle. Last week, I mentioned to you about how we have three different phases in our hair cycle. So I'm going to use my little visual, my circle. So we have the anagen stage, which is this thumb down here, anagen stage, which is your growth phase, your catagen stage, which is like your transitional stage, and your telogen stage is your resting stage. So with um, anagen effluvium, it actually affects the anagen stage, which is your growth phase. Okay. With that, it is a non-scarring alopecia, which there are some great results of hair coming back from non-scarring alopecia. So what is it that actually causes for anagen effluvium? Sometimes it happens through an infection, a drug, a toxin, a radiation, or some type of autoimmune disease. We relate this the most to chemotherapy, and this month is October, so it's breast cancer awareness. And this really affects a lot of women and even men, because men can have breast cancer as well. So this is very sensitive topic, and I wanted to go ahead and talk to you about that and what the effects and what we can do. So typically when you go through chemotherapy, alopecia, which I spoke to about last week too, alopecia, typically a doctor would um, diagnose you with alopecia, which means hair loss. So alopecia, hair loss, develops within 2 to 4 weeks of your chemotherapy. It actually occurs about 65% of our patients that's undergoing chemotherapy that would be affected with losing their hair. It usually happens on the scalp, but at times it can actually happen in other places in our body, like our eyebrows, our armpits, or in our private area. Your hair will actually shed out. Um, so that was one place of it. Typically, when you start your chemotherapy, you won't start experiencing the hair loss into that 2 to 4 weeks, but you can lose up to 90% of your hair over a period of week when you start chemo. So typically we'll go over um, anagen effluvium by carefully going over your history, your recent type of medication, and examining your scalp to see it clinically and by a trichoscope. So a trichoscope is a tool that I use to do my scalp analysis to evaluate your scalp and your hair strands and so forth. So that is one of the tools I will use to kind of get the feel of what's going and what type of hair loss you're experiencing. Now, anagen effluvium. Oh, hey, girl. Thank you so much for joining me. Now, Andrew, sorry, I was going back. Um, Anagen effluvium is reversible. The hair follicle resume normally activity, but it happens after the detox in your body is withdrawn. So typically the regrowth on a hair is 3 to 6 months after chemotherapy in most cases. Now, this is the part that is going to get a little bit real that I want you guys to really, really understand, okay? So studies show that patients have reported that losing their hair was actually the worst experience than losing their breasts. It affected to them more of them losing their than losing their breasts. The reason for that is because the hair loss is more visible. it's a constant reminder of them going through their cancer, um, and also a reminder to other people when they see them, because automatically, not knowing the person, when you see someone who is completely lost their hair, you automatically think of chemo, and that does happen. But that's one of the things that really affects men and women about this hair loss. It plays a big psychological effect in a person who is not only having breast cancer, but also that change of losing your hair, your who you are, your identity as a woman. That's who we are. When you think of somebody, you remember them as the girl with the super curly hair, or the girl with the amazing red vibrant hair. You refer to people with that, so it plays a humongous psychological effect to someone who is losing their hair, especially with chemotherapy, because it happens so suddenly. Now, here's a crazy thing that I found, um, even researching, because I wanted to see some studies on the effect that it does for women when they're going through chemotherapy. So there's about 8% of women who actually considers refusing chemotherapy because of the risk, and the risk of losing their hair, the change in their body. But it shows that one of the main reason is so they don't want to lose their hair. So there's different things that we can definitely help in the salon, but this is the one thing we do. Treatment can happen as an option after chemotherapy. After chemotherapy, we have to be able to balance out your body, basically detox your body, detox everything out of there. So then that way we have like a clear surface to work with. Now, when you say after chemo, but what about while I'm going through chemo? While you're going through chemo, what I will recommend is a non-surgical hair replacement. In the field of cranioparesis, I spoke about cranioparesis under my non-surgical hair replacement segment. And what it is a medical wig. It will be cut, color, style exactly, or at least close enough to what you had before. We want you to feel beautiful and enjoy yourself, not lose yourself throughout this transition in your life. We are there to just help you and balance you out. And if you actually know someone who is going through breast cancer, who is going through this struggle, it is emotionally, be there for them. Have them contact me. You guys can definitely visit me at www.fabulouslymaysalon, and I will be more than happy to help you. We can start off with a complimentary 15-minute consultation. There will be 5 easy questions for you to fill out so that we can go ahead and get started. I will actually call you, review everything with you, and from there we can move forward to the next options that would best fit you. I want to thank you guys so much for joining me this evening. I hope you guys had an amazing weekend, and I'm looking forward to continue this hair loss segment and giving you the information, because alopecia is just hair loss, and we got so much to talk about in hair loss because there's so many different types of hair loss. So thank you guys so much again. I really, really appreciate you. And feel free to DM me or visit me on my website at www.fabulouslymaysalon.com. Thank you guys so much. Have a great evening. Take care.